όχι. Λέω da la colonna. Меня никто не вылечил, а так получается. Лишь будешь меня лечить.
You don't need to be treated, my friend. You are compensated. You need to be restored. That's different.
All on four, όπως all on four και fillers. Botox, fillers.
Rhinoplasty.
Yeah.
We'll make Italian of you, you know.
Okay.
There was a joke, and when it was a World Cup in Moscow, and it was says like, please, women, beware. Italian team left the country. If you see the Italian soccer players, beware, they are Armenians. A lot of Armenians actually, they sometimes say, well, we're Italians because we look like much, you know.
Yeah.
At least they want so. Okay, or we can also see that if we go to the X-ray mode,
Now we play with the prosthetic plan. No?
yes, well, we just play with the jaw, we see the
Yeah.
jaw. So if we want this trajectory
Yeah.
to be given to the technician, for example, we can do that. So yesterday we discussed when we choose the position, yes, initial position, or we can just go and export trajectories, yes. To like. Okay. So right now I will show you a movie that were created by the guy who invented it. I will try to give some comments, but I think it will be self-explanatory because you already seen how it work. He did it for me, for my patients. I will find it. Yeah, especially for you. Going to comment. So here is his patient with a click in a joint. So they want to do a splint to stop the click. So first, as we've seen, they download the models in the program. And the next, I will find a video of the complete analysis, and please, you together, looking at the screen, try to just saying what you're seeing. In that case, you'll remember it, like yesterday with axiography.
Can we make a 5-minute break?
Yes?
5-minute break, please.
How much time it takes for you to make the analysis?
I would say that...
No, with the patient, after.
Yes. I usually spend for this software 40 minutes.
40
Yes.
2 hours and a half with the patient.
2 hours, and it's not axiography, it's complete diagnostics.
The complete
Yes.
diagnosis.
Sometimes it's less. Because, for example, if a TMD patient, I always record the questionnaire. And it alone could be like 20-25 minutes, because, but it's very important to do that. There is so many information inside. So if it's a normal patient without complaints and pain and everything, I will not do questionnaire with me. I just ask to fill in the questionnaire without me. If it's a patient that has these complaints, sometimes all this analysis is nothing, only the questionnaire is most important.
We have to change the mentality. Greek people, I don't know, it's very difficult with the patient here. They call me and they ask me, I have to do an endodontic treatment.
Who
I don't know
decided
them.
that?
Yes,
Yes.
who decided that? I want this teeth endodontic.
It happened with me, once.
And okay, I have to pay you for the.
Well, I said, okay, this is the handpiece, these are the instruments, my
Yeah.
assistant like $100 an hour.
Yeah.
I will just leave the room and you do whatever you want with you.
Or they look on the YouTube,
Yeah.
you know,
Dr.
and
Google,
they
yes.
know everything. And
Well, it's I don't know what kind of advice to give because we have problems with patients. I think that it's a worldwide problem is that to be a good dentist, it's every year is more and more expensive. I mean, to get knowledge, to buy everything you need. Right now, we can't work on something that was even 20 or 10 years ago because the technology is changing
Upgraded,
faster.
yes.
Like, it's okay for any person to change iPhone once a year, but he doesn't understand when we need to upgrade our equipment also very often. So it's very expensive to be a good dentist, and you can't, and at the same time, patients usually we understand that dentistry is too expensive for a normal patient. So what should we do then? I found a solution in prolonging the treatment. I'm telling patients, you have the right to decide because I can do whatever you say. If you came here for 1 crown, if I write down in the chart that you don't need the 1 crown, you need a whole mouth rehabilitation, and it means that my plan is this, your plan is this. It means that I will be responsible for your plan. In a way, it is different from my plan.
Yeah.
The closer your plan to mine, the more responsibility I would have. The more my plan is changing from your plan and you don't want to accept it, the less responsibility I would have. And I will write it down and say, okay, you need total mouth rehabilitation, you decline, this is what we do. I will do the crown, I'll be very happy to be a doctor, but these are the risks you have to take if you wanted this crown to be made without nothing else. Please sign that you acknowledge this risk, you're informed about these risks.
You agree.
And for me, it's no-brainer. I can do the crown. I would feel even better because I don't have to be responsible. I just have to prep, to make the impression, and I like this work actually. It's very profitable. But my work is to protect myself afterwards when there will be chipping and there will be loss of this tooth or something else. So when we have to go, this color was A3 because other teeth A3, and then he finally wants to do bleaching. So. And patients, okay, some of them say, all right, I'll take this responsibility. Some of them say no. So if no, then let somebody else be a problem. Or they say, okay, I understand. Or I can tell them, I understand you don't have money. I agree this is a big sum of money. Let's imagine this is where you are, this is where you have to be. What is better, to stay where you are or to come here, stay here a little bit and to come here and gradually reach this level? So, okay, you don't have 8 teeth. Let's do 2 implants, 2 temporary crowns. Let's not do final crown.